Good afternoon. Let's inject our Lipo B. So I'm so excited. I just got mine in. We'll just receive a little insulated package from the pharmacy with some foam. Not insulated, sorry, just a little padded package, okay? Always read your inserts. They're so helpful. So you get your injection supplies, alcohol swabs, you get your Lipo B with the instructions, okay? I did mine subcutaneously. Lipo B can be intermuscle or subcutaneous. So either in the fat, okay, your arm, your stomach, your thighs, wherever there's subcutaneous fat, or it could be in your muscle. I have mine for subcutaneous. I don't care for intermuscular injections, okay? There's just a little label. There's some information on how to draw up and inject your medication, okay? So please read the inserts. Also, the pharmacy is super helpful. If you have any questions, reach out to them. I have just washed my hands. This is my personal medicine. I'm not going to wear gloves. If I was drawing up for a patient in the office, we would certainly have on gloves, okay? So you get a 10 ml vial. It's sterile. You get your alcohol swabs and your injection supplies. These are insulin needles. They're 31 gauge, so it's a super small needle, and it's the whole ml. 100 units is what we're drawing up. Here is the needle. Just crack the top. This is sterile. The very first time, you don't have to clean it. You just inject just like a bullseye, like you would if you were throwing darts, okay? You want to remove the plunger off. You invert the vial, pull down. Some people may have you inject air before you start. Sometimes if you inject a little air, it's easier to pull up the medication. Meds can take a little while to draw up too. Remember, it's a super small needle, so it does take a little while to draw up the medicine. But if you just pull it all the way down to where you want it, it's just going to keep rising. You don't have to do any more work. You pull down, it's going to create a vacuum, okay? So I'm a little past the 100. I'm just going to push up to 100, and I'm ready to inject, okay? If you want to clean yourself first, you can certainly clean yourself. You can do your belly around here. You can do the arm if you're going to do the arm, and I'll show you. You just hold your arm up like so, okay? Clean in a circular motion, starting in, going out. If you want to clean first, you can, so it gives it a few seconds to dry. There's no air bubbles or anything like that. And then you usually want to inject at a 45-degree angle. This is 90, just going straight in, so 45 degrees. Boom, once it's in, you go ahead and push your plunger. It's always a good idea just to hold for 5 seconds. You may get some backflow of the medicine. We've just injected a whole ml, so it's not abnormal to get like a little bit of backflow, okay? I always slide the cap back on my needle, and then you just dump this into the sharps container.